Good morning. Welcome to the EHRA Congress here in Paris. My name is Paula Sanchez. I'm a cardiac electrophysiologist coming from Spain. I am a member of the EHRA Patient Committee, and I'm here joined with 3 other members: Marcin Rosicki, who is a patient coming from Poland, Dr. Silvia Ribeiro, a cardiac electrophysiologist coming from Portugal, and Dr. Jean-Claude Diago, a cardiac electrophysiologist coming from France. So thank you very much for being here. We are going to discuss today, we are going to talk about syncope. So Jean-Claude, let me start with you. What does syncope mean, and what are the most common causes?
Well, it's a very important question, because syncope is like an obscure word, I would say, even for doctors and even for patients. Syncope is a transient loss of consciousness due to the fact that the blood flow doesn't go to the brain in enough quantity in order to maintain normal consciousness. So it's like an hemodynamic loss of consciousness. It's nothing to do with electricity, nothing to do with any disease of the brain. It's just that the blood flow is not sufficient enough. And consequently, the causes for this are the causes for a sudden drop in blood flow to the brain. And there are 3 main causes. I would say that the most frequent is called a reflex cause. A reflex cause means that due to some information which was not well interpreted by the brain, the order was given to the heart and to the vessels to decrease the blood pressure and to decrease the heart rate. And consequently, the blood flow is not good enough. The second cause for frequency is a drop in blood pressure. It's called orthostatic hypotension. It's very, very common in old patients. It is due to many things, but we can keep in mind that drugs, mainly drugs for hypertension, are the main cause. And the last cause, and the more frightening cause, are the cardiac causes. The heart may suddenly slow, suddenly accelerate, or have a structural problem. So these are the causes.
Thank you very much, Jean-Claude. So Marcin, now, from the patient's perspective, what does syncope feel like, and how can it affect your daily life?
Well, from my perspective, patient perspective, is a very strange situation, because when you feel good, you feel well, yes, and in a few minutes, a few seconds, you can feel that you have to go to the down. You feel that you have some roller head, you are blind, yes, you feel that you are dizzy. You can't expect what will be happen next. How will be next step? Yes, for me, like patient which had this syncope a few years ago, before pacemaker implementation, I remember that I was afraid. I feel fear when I drive.
Yeah.
Because I cannot expect what will be happen when I go to the syncope. Yeah. Yes, I lose the mind and go to the road, sure, to another participant on the road. Yes.
So after the first episode of fainting, you are afraid of having more.
Exactly. So, but after implantation, my pacemaker, I feel it better.
Okay.
But after, no, it's good, but not exactly, because when you had tachycardia, very fast heart rate, also you can have a syncope.
Yeah.
Like patient.
Thank you, Marcin. Sylvia, let's continue with you. How can patients recognize syncope, and especially, are there any warning signs before it happens?
Well, I think it's very important to distinguish it between syncope and other causes of loss of consciousness, including neurological causes. And as previously noted, syncope is defined by a loss of consciousness of short duration, rapid onset, and rapid recovery. That's syncope. many times, especially in the most frequent type of syncope, the reflex one, there are some warning signs. And this is very important for patients so they can try to abort syncope and protect themselves from trauma. And there are some warning signs like dizziness, diaphoresis, a feeling, a non-specific feeling of sickness, nausea, and at that time, patients can try to abort syncope and protect themselves.
Okay, thank you, Sylvia, very much. Now, Jean-Claude, so when a patient experiences a fainting episode, what should they do at that moment?
Well, I think Sylvia pointed out that if there are warning signs, like the ones she described, of course, the best thing to do is to stop anything doing, including, for example, driving a car, to stop immediately and to put in a lying position. Because putting the patient in the lying position will put the brain at the lower possible level, and then the blood may come back. And I also noticed in Marcin's answer that there is some frighten about recurrences, of course. And I think that the good thing to do is to go to a doctor, even if it looked like a very benign episode, to go to a doctor and have a description of what occurred, and then take decision, go to a specialist or not. This is very, very important.
Yeah, thank you very much, Jean-Claude. So, Marcin, in other words, what do you think? How can family members and friends help when someone faints?
When me or another patient has syncope, first of all, don't panic. Don't panic. Please calm, because panic is also more dangerous situation like syncope. Yes. Keep to bed, keep to ground, ground legs. Yes. Please wait. Maybe, of course, if we long time is syncope, call to the doctor, to emergency. Yes, please come to us because my friend, my husband, my wife has syncope. I don't know what happened.
Yeah.
Yes, but first of all, don't panic. Please calm.
Thank you. Very good advice. So, Sylvia, Jean-Claude already addressed a little bit, but when should patients after fainting should seek for medical attention? Always, sometimes? What do you recommend?
I think that after the first episode of syncope, every patient should be evaluated by a physician, even if it is a vasovagal syncope, the most benign one. So we can reassure the patient, we can educate the patient how to abort syncope, how to protect from injury. So it's important to see for the first time and to educate the patient. Then there are some red flags for some kinds of syncope that should include other kind of specific evaluation and sometimes hospitalization. Yeah. I think it's very important to realize that the severity or the level of trauma, if there is a trauma, is not directly related to the prognosis of the syncope. And there are some red flags like palpitations, chest pain before syncope, syncope during exertion, during supine position, if there is some kind of hereditary condition in the family, an history of sudden cardiac death, or if we have an ECG, a basal ECG with abnormalities, all of these are red flags.
Thank you very much, Sylvia. To finish this interview, Jean-Claude, what are the possible medical treatment for syncope? What are the different treatments?
Yes, very, very important. I think since many syncopes are reflex, of course, the treatment should be as benign as possible. And I think reassurance is very important, and this is exactly what Sylvia told and what Marcin wanted during syncope. Reassurance is the very, very first step in many reflex syncope. And then afterwards, if it doesn't work, we could go into a complex workup in order to see if another option is necessary, including drugs. But we don't like to give drugs lifelong. including cardiac pacing or cardioneuralization, which are things which are very limited in terms of indications and in terms of patients. And of course, if there is a condition like a severe condition, we should go to severe condition treatment. And finally, in old patients, it's very important to consider withdrawal drugs which are responsible for lowering blood pressure.
Yeah, thank you very much. I agree. So thank you very much. Thank you all for being here. Thank you for sharing your experience and your knowledge, and enjoy the Congress.
Thank you very much. Thank you.